Anxiety, we all feel it sometimes. A big presentation, a first date, a looming deadline. These situations can trigger those familiar butterflies in our stomach. But what happens when the feeling persists, even when there's no obvious threat? That's when everyday life can start to feel overwhelming. Anxiety, in its truest sense, is our body's natural response to stress. It's a feeling of unease, worry, or fear. Imagine it as your internal alarm system designed to alert you to potential danger. In small doses, anxiety can be helpful, even motivating. It keeps us alert and helps us avoid potential harm. However, when this alarm system becomes overactive, when it's constantly ringing even when there's no real danger, that's when anxiety becomes a problem. It can interfere with our daily lives, our relationships, and our overall well-being. Why do some people experience anxiety more intensely or frequently than others? The answer, like most things related to mental health, is complex and multifaceted. There's often no single cause for anxiety, but rather a combination of factors that contribute to its development. These factors can be broadly categorized into three main areas: biological, environmental, and psychological. Our genes, brain chemistry, and even our personality traits can play a role in our predisposition to anxiety. Life experiences, such as trauma, abuse, or chronic stress, can also leave a lasting impact, making us more vulnerable to anxiety disorders. Furthermore, our thought patterns, beliefs, and coping mechanisms can either exacerbate or alleviate anxiety. For instance, negative self-talk, perfectionism, and a tendency to overthink situations can fuel the flames of anxiety. Anxiety manifests itself in a myriad of ways, and its symptoms can vary widely from person to person. Some people experience primarily physical symptoms, such as a racing heart, shortness of breath, dizziness, or muscle tension. They might feel restless, agitated, and constantly on edge. Others might struggle more with emotional symptoms, like feeling apprehensive, worried, or fearful. They might find it difficult to relax, concentrate, or even enjoy activities they once found pleasurable. Anxiety can also manifest in our thoughts and behaviors. People with anxiety often experience racing thoughts, worry excessively about the future, and find it difficult to control their negative thinking patterns. They might engage in avoidance behaviors, such as avoiding social situations, public speaking, or anything that triggers their anxiety. The good news is that anxiety is highly treatable. With the right support and interventions, individuals can learn to manage their anxiety and live full and meaningful lives. Treatment for anxiety typically involves a combination of therapy, medication, and lifestyle changes. Therapy, particularly cognitive behavioral therapy, CBT, has proven to be very effective in treating anxiety disorders. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to their anxiety. Medications such as antidepressants and anti-anxiety drugs can also be helpful in managing anxiety symptoms, especially in the short term. They work by balancing brain chemicals that regulate mood and emotions. Lifestyle changes, such as regular exercise, a healthy diet, adequate sleep, and stress-reducing techniques like yoga or meditation, can also play a significant role in managing anxiety.